Welcome to the Health Angle Podcast with Dr. Mike Headley and Dr. Gordon Fimwright, where we'll be exploring different angles of health to achieve the best version of yourself. Now here's your hosts, Dr. Mike and Dr. Gordon.
Welcome everybody. I am Dr. Mike Headley, and with me is Dr. Gordon Fimwright. Welcome, Dr. Gordy.
Hey, Mike. Welcome everybody to the Health Angle Podcast. Today's episode, we're going to talk about frankincense. And the subject is from joint issues to gut health, the whole body benefits of frankincense. So we're going to dive into this, and welcome to the Health Angle Podcast.
Yes, Dr. Gordy, I am excited. It is one of my, if not my favorite essential oil, frankincense. I scanned it on our Yucca app that we both highly recommend. This brand that Aura brand, 100 out of 100. So I was pretty excited that I had that on my shelf, that it's that top rated. I'm sure there's a lot of other top rated essential oils. So absolutely excited to talk about this. And I just have 11 reasons why people should start using frankincense oil. So what do you got, Gordy?
Well, I know that some people have heard of boswellia serrata. That's a supplement, and basically this is a extract of the frankincense resin. So, and I know this has been around for thousands of years. There's religion, rituals, there's perfumes that made up from it. A lot of tradition, a lot of ancestral, ancient use of this. Modern uses, aromatherapy, essential oils, as well as traditional medicine and supplementation. So I know there's some great benefits, and I can't help but to jump into the first one because I know it's really dear to you and I, Dr. Mike, because we take care of a lot of patients that have neuromusculoskeletal problems. So I think this is really important for those that don't want to jump into medication. They've tried the chiropractic and physical therapy. They've tried a few other routes, and they just aren't quite guided to where they should go. And I think this might be something they should really give it a fair shake. And the first benefit that I have, and probably one of the most useful uses of this supplement, is anti-inflammatory support. And the main compound is boswellia acid. And so it's widely used. Frankincense is widely used for joint pain, osteoarthritis, as well as rheumatoid arthritis. And there's a main anti-inflammatory component called the 5-lipoxygenase. And that's where all the miracles happen right there, to reduce inflammation. So I know there's some studies that are showing reduced joint swelling and pain. Comparing that to the NSAIDs, and we all know that people are taking NSAIDs, that's non-steroid anti-inflammatories, and there's a whole bunch of side effects when we're dealing with NSAIDs. And boswellia, as well as frankincense, have really been showing some really positive things. I have a 2004 study just from last year, and it talks about boswellia serrata extract trial. And it was a recent study on boswellia serrata extract showing great results for people with, and they happen to use knee arthritis for the study. At just 150 milligrams, it reduced pain by 45%. And at 300 milligrams, it reduced pain by 62%. And it also improved joint function, lowered key inflammatory markers. And overall, it looks to be safe and effective option for easing joint pain and boosting mobility. And then there's the other studies. There's one that was done on some rats that help with peripheral nerve regeneration. And that's pretty exciting. And then, of course, the topical application for knee osteoarthritis. That was a study done in 2003. And then there's oil supplementation geared towards the osteoarthritis and the back. So there's really good studies out there validating this. What do you have, Mike?
You know, I'm more focused on the essential oil, frankincense. I take a product called Arthroid Plus, though, that has boswellia. herb in it as well. So those are the two ways that I use it. And the essential oils carry biological active volatile compounds in a highly concentrated form that can provide therapeutic benefits in very small amounts, which is really exciting. The frankincense, the essential oil, commonly referred to as the king of oils, we talked about the king of mushrooms, chaga, in the past, is made from the resin of either the boswellia sacra, S-A-C-R-A, or boswellia carteri tree. Mine is the boswellia sacra, and the cool thing about this is, scientifically, there's a lot of research on it. It's shown to speed wound healing. Get a cut or a scratch, or you're doing some yard work or a bruise. So speeds wound healing, reduces inflammation and stress. We've talked a lot about that on our podcast. Boost your immune function. We've talked a lot about that as well. Improve oral and uterine health. Treats respiratory issues, which is super common right now with dryness up in the Midwest where I live, and dust and allergens and pollens and things like that. So it treats respiratory issues, digestive disorders. It promotes sleep and actually fights cancer. There's just so much robust information on this. And then, the studies show that it induces cell death in cancer cells, including malignant melanoma cells, breast cancer, and pancreatic cancer cells. So that's just really exciting. And I'm not saying go get this little bottle and you're cancer free. That's not what I'm saying, but there's just so many health benefits of using boswellia or frankincense oil. And so that's one of my 11 things that I'm going to try to give people reasons for using frankincense. And you already mentioned it, reducing inflammation and inflammatory conditions. So really, really exciting. If people aren't using it and they don't know about it, a 0.5 fluid ounce bottle, which isn't a lot, but it actually lasts a long time. I mean, you can get it on sale for $17 or $18. It's not, this is almost half price. So it's kind of an expensive oil, but buy it on sale.
That's great. But the common denominator is reducing inflammation, which is phenomenal. Speaking of, the next one is that I have. The second one is for gut health. And again, showing these inflammatory conditions such as ulcerative colitis that can help by it, Crohn's disease that can help by it, as well as irritable bowel syndrome. So it reduces gut inflammation, improves bowel motility. When we talk about the gut, we talked about this before, about 70% of all your gut and immune function is right there in the gut. So 70% of your immune system is in the gut, because where does your body meet the outside world? And your immune system has its first defense, its first frontline defense. It's in the gut. It's the digestive tract. And it's like a security checkpoint. And where food or bacteria or virus or toxins basically pass through there daily. And it's a check. It's a check on your immune system to get these things out of your system so your body can function the way it was intended. So the gut is constantly attacked with these outside world items. And even what you drink can have a factor. So your immune system is set up to kind of basically monitor these threats. But going right back to the inflammatory parts, the anti-inflammatory properties of this is really phenomenal. So that's my second one, Mike. I'm going to shoot it right back to you.
Yeah, the boswellia tree grows in Africa and Arabian regions, including Yemen, Oman, Oman, Somalia, and Ethiopia. I thought that was interesting. Frankincense speeds up wound healing, like I mentioned. I'm going to go through my top 5. Fights the appearance of stretch marks, age spots, and wrinkles. Reduces inflammation and inflammatory conditions. And you mentioned rheumatoid arthritis, and also bronchial asthma is an inflammatory process. Reducing stress hormones, the high cortisol spikes, the adrenaline spikes, boost immune function, and improves oral health by preventing bad breath, cavities, toothaches, mouth sores, and other infections. And that I really didn't know about that. So I'm glad I did some more studying on this, because I didn't know about the oral health as well. So I have about half more dozen really good reasons to start using frankincense. And then I would like to talk about just kind of how to test it on yourself to see if you have any reactions and just some different ways to use the oil.
I think frankincense, so boswellic, has really been kind of rippling through into the orbit of making it conscious. In other words, we're starting to see that in some wellness circles as of recent, even though it's been around for thousands of years. Do you get that sense too, Mike, that it's just being started to be pushed?
Yeah, yeah. I mean, in my region, there's a few multi-level marketing companies that sell essential, that use essential oils, and the mantra is, when in doubt, use frankincense. What do you do for a cold sore? What do you do for a shoulder, muscle ache? What do I do for my stomach upset? Yeah, there's a ton of different, there's hundreds of different essential oils, but they always say, when in doubt, use frankincense, because it's just so universal and beneficial on so many things.
My third one is stress relief and mental clarity, and using it in the form of aromatherapy, just like what you were discussing, Dr. Mike. So anxiety, depression relief, and promoting calmness and spiritual grounding, basically. And it's often used during meditation, yoga practices. So I think that's awesome. I'm going to jump right into number 4. We'll probably have some overlays here, but at least will doubly accentuate how important this one is for different conditions. You had made reference to this already, skin health and anti-aging. So the frankincense is basically an essential oil applied, perhaps diluted in some cases, for reducing wrinkles and scars and revealing feeling and really skin rejuvenation. And again, antioxidant as well as antimicrobial. So kind of both into one natural skincare type of product. The next one is respiratory support. Things like asthma, bronchitis, and sinus congestion. Again, the anti-inflammatory properties of this has been very positive.
I know we're kind of repeating each other a little bit, and I mentioned some of these already, but it is critical, and I just want people to hear this once or twice or 3 times. So my other 6 things that frankincense you should maybe consider trying is: supports uterine health in women by regulating estrogen production, can help regulate menstrual cycles in premenopausal women, treats respiratory issues such as colds, allergies, asthma, and bronchitis by reducing phlegm buildup and congestion, which is really common, promotes sleep. We had a podcast on sleep, and I don't remember mentioning frankincense oil with that, more about lavender and other relaxing oils, but absolutely frankincense promotes sleep, improves digestion, and treating digestive disorders like you had mentioned, chronic colitis, ulcerative colitis, and Crohn's disease even. And then it just fights cancer, not every cancer, and not just a one-time use with cancer, but there's just massive amounts. And then one thing else I learned is one of the best oils to use for removal of skin tags. Skin tags can be found under eyes or armpits or the little things. And so, I'm really curious to see if any of our listeners have ever used it to help with the skin tag. If you have, comment below and let us know what your success rate is.
Oh, that's great. Couple others I'm just going to breeze over, Dr. Mike. You had mentioned cancer, but there's actually studies being done right now, mostly lab studies, that are showing some positive effects of cancer in both these products, oral health as well, gum care and mouth inflammation. And there are some positive studies in those ones too. Again, going right back to the common denominator, and that's that anti-inflammatory property, which is critical. We've talked before about most, if not all, disease starts on the cellular level. And if you get to the cellular level and get that healthy, get that mitochondria working, and reduce some of the factors, the negative inflammation to the at the cellular level, you're going to be so much further ahead. Back to you, Mike.
So when it comes to essential oils, quality is paramount. And so take us up on that Yucca app and scan your essential oils, because if it's a good essential oil, it should have a barcode on it. And if you go to, I'm not picking on TJ Maxx, but I am picking on them because you can buy a, 4 pack of essential oils for like 5.99, and that does, it's probably more of a fragrance that smells like the oil. It's not the essential oil. So it doesn't have to be $100 an ounce, but if it's $5, for a gallon, it's probably not high quality. And so there's a few ways you can use frankincense oil. Add a drop or two to your favorite carrier oil. A lot of people use coconut oil, and then you can rub it on your skin or joints or body. Add a few drops to your bath, especially if you like Epsom salt baths for your feet or your body, and do kind of create an aromatic soak, and you can pair it with other oils as well. Apply a drop or two to different pulse points during meditation on your wrists, carotid artery area, and put it, if you're using a hot pad or hot compress, put a few drops of oil on first. Diffuse an oil in your office or bedroom or living room if you want to diffuse the oil as well. One of my favorite points to put essential oils is not on the feet, bottom of the feet, but also around the belly button. It's a really central part of the body where we had our umbilical cord, so it absorbs into the body. You can put it underneath your nose and on your wrists, and then you can smell it routinely. And I'm just a big fan. I thought they were kind of hokey years and years ago when I first heard of essential oils, but the research says they really, really do good stuff. And like I said, quality is paramount to really make sure you get the highest quality. If you're going to put it inside you or on your skin, goes into your body. So make sure you're getting good quality stuff.
Yeah. And I want to just make a note. I know we've kind of gone back and forth with whether it's topical or some type of supplement that you would take orally. If you're doing it orally, of course, check with your doctor to make sure that your drugs aren't going to be having any kind of interaction. With that said, Mike, I would just want to conclude my section by saying Frankincense or boswellia works on calming inflammation, whether it's happening in the body, whether it's the joints or the lungs or the guts or elsewhere. It's just so versatile. It gets the bottom line is, I think it's great for calming that inflammation.
Yeah. Frankincense oil is probably one of the safest and most beneficial essential oils you can use to support your health. One way to really test it is they do a patch test. So you can put a little bit on your finger and then just maybe put it on a part of your skin that's so-called doesn't need it and it's really strong and healthy skin. Don't put it on a rash right away. Don't put it on a cut right away, even though it's good for wound healing and all that stuff. Just put it on there and wait a day. If you don't get any redness or irritation or rashes, or it's regarded as safe to use, internal and external, and it might not be suited for everyone. But if you have any adverse reactions, stop using it. Of course. So, one last thing, according to the National Association for Holistic Aromatherapy, frankincense essential oil diluted with a carrier oil is safe to use during pregnancy, it says. And Autism Parenting Magazine recommends it for children on the autistic spectrum and or those with attention deficit hyperactivity disorder. So that I thought that was really cool. And it's safe to use with children as well. And like we said, sleep and inflammation and phlegm and immune boost, all these other things. And yeah, you could get some rash or nausea or stomach pains and different things like that. Just start out slow and easy, and talk to your doctor if you're on a bunch of medications and or blood thinners and cholesterol pill. If you're on 3, 4, 5 things, definitely talk to your doctor about it and don't just throw them out and say, great, this essential oil can cure everything. Well, no, it's a really part of a healthy lifestyle, and it has a lot of health benefits. And I'm excited to see if our listeners use it. And if you do, comment on how you use it and your benefits. And if you don't, maybe you try it for a month and then get back to us and let us know your comments on the positive benefits.
That's great. Mike, before you close out, I just want to ask you personally, I know you ran some marathons, you put some stress on that pelvic and hips and everything else. Have you used the topical for your condition with the hip and
Yeah, yeah. I like I said, it's one of my favorite essential oils, if not my favorite. So I use an essential oil mix I make with DMSO and castor oil as my carrier oil. Then I'll use frankincense and peppermint and eucalyptus and ginger and rosemary, are other anti-inflammatory oils. They don't have the 10 or 20 different benefits, most of them, like frankincense. That's why when in doubt, use frankincense. I'd like to end our episode with, what's your number one takeaway that you can share with a coworker tomorrow? Is it your first introduction to frankincense and boswellia, or you can just ask how your coworker uses it and different ways they do it, and maybe you can share different ways that you use it or have used it, and or comment below in our comment section some positive benefits that you've received from using this. And then lastly is what's your number one action step based on what we talked about today? So we like people to take action, write things down, research it, do something the day they listen to the episodes, so you can positively move your health in the right direction little by little, or giant leaps every week. So with that, what are you going to leave us with, Gordy?
Hey, Mike, thanks. That was great information. And next week we'll have our next episode. I'll put that up. And so we do this every week. So if you haven't already, please subscribe to our podcast. Please like our content, hit that notification bell. And then until next week, I guess we'll be back with the Helping Go podcast with another episode. Until then, we'll see you.
Thank you for joining us on the Health Angle podcast. Please subscribe to our channel and catch us for our next episode.